Alright, we are going to have this presentation, the abdominal scanning protocol. But however, we are going to be dealing with organs by organs, and for this case, we are going to start with the liver and the gallbladder. Alright, as usual, Dr. Ed, I'm here to help you. If you do get challenges with the scanning the liver, please say that pay attention. This presentation will help you greatly. Okay, so as usual, before you start any ultrasound procedure, it is better to first prepare yourself and also prepare the patient. These are the a series of preparations which we can do for our patients. So number one is creating a report. So creating a report involves things like greeting the patient. You can say morning, you can say good evening, and then introduce yourself to her such that you don't look like a stranger. Assess any related document. Is it a follow-up? Has he or she ever done any abdominal ultrasound? Then also you explain the need for the scan according to the requesting clinician. You can explain the procedure in any simple language. You say, I'm going to do a scan. This scan is harmless, but I want to find out what the challenges which may be in your abdomen. Alright, so seek verbal consent, definitely by asking that is it okay starting. Alright, so position the patient like how we saw in the other slide. In abdominal ultrasound, the patient should be positioned in supine, that is lying on the bed while facing upwards. Alright, so expose the part of interest and tell her that I am going to apply this gel, which is to help me obtain better images by improving the contact between the body and the transducer. Others say just to remove air which can be between the transducer and the skin of the patient. Alright, so you just from there go to machine settings. If your scan is off, then better way turn it on. Then you input a new patient. You input the biodata, that's the name, the sex, age, all that relevant information. Select the probe. In this abdominal we use curvilinear because it has a wider field of view with the deeper penetration compared to the linear probes. So you select exam, and for this case it is an abdominal ultrasound. Then using the liver, you set the gains. The liver is used because it is the largest abdominal organ, and relatively it has a homogeneous echogenicity. So set the time gain compensation, that is to correct attenuation, and also set the overall gain for uniformity of the returning echoes. To every organ of interest should cover at least 2/3 of the screen, so set the depth accordingly. Set the focus to improve the lateral resolution, and finally you're gonna have an image which looks like this after setting the gains. So you can see this is the liver, and we can see its relative homogeneity, We can see it's very nice. You can see the echoes in the near zone and the far zone. They are very, very clear and homogeneous. Alright, so like how I've introduced the session, we are going to look at the liver. So the whole of this is the liver. We can see the gallbladder, and then we can see this other hepatobiliary ducts, the cystic duct, the common bile duct, and these portal veins, and also the hepatic arteries. Alright, so if you want to scan the liver very well, and according to the protocol, scan it in 4 windows. One, we have the subxiphoid window, then the mid-clavicular intercostal window, the mid-clavicular subcostal window, and the anterior axillary window. So using these common anatomical landmarks, we know where the xiphoid process is. So under it, mid-clavicular along with the clavicular line, and then along with the anterior axillary line. So for intercostal and subcostal windows, they are all in the mid-clavicular line. Yes, note this, that all scans should include both sagittal and transverse views. So we are going to look at each window separately, and then we see which organs can we see in this case. So starting with the subxiphoid window, we can see this image, which is described by these notes. So this is the left lobe of the liver. We can see the inferior vena cava. So in this window, when you're in sagittal, definitely this is the inferior and this is superior, whereas this is anterior and this is posterior. So we can see that anterior to the inferior vena cava, we have this, the caudate lobe. So you have to see it. Whereas anterior to this caudate lobe, we have this hyper-echogenic looking like a line, which is the ligamentum venosum. So anterior to this ligamentum venosum, you have the left lobe of the liver, but we can also see this the umbilical segment of the left portal vein. So this is the left lobe of the liver. Okay, so that's what you can see. You try to rule out masses in the left lobe of the liver. But like how we've said that you scan both in sagittal and transverse, we shall see a transverse view of this very image. For the ligamentum teres, it's always at this point. Here it wasn't captured clearly, but it's always here at this area. So let us see the transverse view, which is this very one here. So with the inferior vena cava appearing ovoid, and you can see also the aorta to the left. So anterior to this inferior vena cava, we can still see clearly the caudate lobe. Then anterior to the caudate lobe, we can see the ligamentum venosum. So we can see the ligamentum teres here. Alright, this is perfect. Okay, so those are the structures through which we can see in the subxiphoid view or window. Alright, so still in the transverse, but when you touch more to the right shoulder, that is angling to the right shoulder, we can have the hepatic veins. They appear anechoic, and we can see them originating from the inferior vena cava while trying to pass through the liver. So these hepatic veins are named. This one is the right hepatic vein, this is the middle, whereas this is the left. And in this case, they divide the liver into segments, where this right hepatic vein divides the right lobe of the liver into posterior and anterior, whereas the middle hepatic vein divides the liver into the right lobe and left lobe almost equally. And for the left hepatic vein, it divides the liver into the left lobe of the liver into the medial and the lateral segments. So they are numbered as we know, and we can see in this image, this is the right hepatic vein, this is the middle, and this is the left hepatic vein. So this is segment 7, which is the superior superior posterior segment of the right lobe, whereas this is the superior anterior segment 8, and this is segment 4, whereas this is segment 2. Alright, so we can also see the main lobar fissure. If we try to angle slightly, we can see it connecting the gallbladder to the portal vein. So this is the main lobar fissure. If you do get challenges in getting this fissure, you can locate the portal vein, then following it, it will lead you to the gallbladder. To some people with the empty gallbladder, you can use this fissure to locate the gallbladder. Alright, so in the mid-clavicular intercostal window, there, if you are in that window, the structures which we can appreciate clearly, we can see this main portal vein. We know the portal veins have hyperechoic walls, so we can see it, and if you follow it, you'll see it, it's branching to form the left portal vein and the right portal vein. And in this case, you can even measure the intraluminal diameter, which shouldn't exceed 13 millimeters intraluminal. Okay, so you can, if you turn around 60 degrees to get its short axis, it can demonstrate what we call Mickey Mouse. And in this Mickey Mouse, the head of the Mickey Mouse is always the main portal vein, whereas the ears anteromedial is always the hepatic artery, whereas anterolateral is always the common bile duct. Alright, that's something which is easy to get. You may be at times struggling harder to getting it, but you just turn around 60, you play around with the angles around. Okay, so in the mid-clavicular subcostal window, this is the window which we use when we are measuring the length of the liver. So you have to have in your view part of the right kidney. You can see the right kidney is here. Then you have to be seeing the diaphragm. Then you should be, if possible, you should be seeing the anterior pole or the lower pole of this liver. But here, either this was hepatomegaly or else it was cut badly, we cannot see this inferior other pole. But for measuring, you just measure from the upper pole around the diaphragm, then you stretch your calipers up to the lower pole. The gallbladder shouldn't be included in this view, so you try to dodge it by angling accordingly. Alright, if you fail to get this image clearer, you may use maneuvers like requesting the client to inspire deeply. So normally the liver measures below or less than 15.5 centimeters. Alright, so what of the mid-axillary? So along the anterior axillary line, still we can get the right lobe of the liver, then we can also get the right kidney. And in this window we rule out masses, but most importantly we shouldn't miss comparing the echogenicities of these the liver and the right kidney. So we can see that this is the right lobe of the liver is hypoechoic compared to the renal capsule. So meaning the renal capsule is hyperechoic. So we can see that the renal cortex is hypoechoic in relation to the liver, and we can see still the renal medulla hypoechoic, whereas the renal sinuses are hyperechoic compared to the liver. Okay, so in short axis still you can have something like this. This is the right kidney, whereas this is the right lobe of the liver. Okay, so still if you missed around the subcostal view in transverse, still you can have this. This is the right portal vein, and it branches to make the anterior and posterior branches. These are very nice in dividing the liver in two segments once again. Okay, so after this, that's all what we can have in a normal liver. So we're going to see what and how the gallbladder looks sonographically. Normally, we know that the gallbladder, as we can see, contains bile, which is always anechoic. Then we can see the cystic duct. We can see the hepatic ducts trying to form the common bile duct. Then we can see the portal vein. Alright, so we can also this is the hepatic artery, then the portal vein, which is posterior. Alright, so let us see the gallbladder. Still, it is accessed in the mid-clavicular subcostal and intercostal windows. You have to scan it in both transverse and sagittal. So this is the transverse, this is a sagittal image showing the gallbladder. We can see it contains anechoic bile. You can see its wall. The wall thickness shouldn't exceed 3 millimeters. Then we can see this is the fundus, this is the body, whereas this is the neck. So those are the gross anatomical parts of the gallbladder. It is very well and very good to scan the gallbladder after fasting the patient for at least 6 hours if at all the gallbladder is not distended. Alright, so you measure the anterior wall thickness on a sagittal image. You just measure it, and the wall thickness shouldn't exceed 3 millimeters. But as usual, you should also get its transverse views. And we can see this is the transverse image cutting through the through the fundus to the body of the gallbladder. You just get this circular image. So still, if you haven't appreciated the main lobar fissure, we can see it once again joining the gallbladder and the portal vein. Alright, so for the cystic duct, always it's not easy to have it, but in this image we tried so hard to get it. So this is the gallbladder. We can see from the neck, we can see this anechoic strip. This is the cystic duct, whereas if you reach here, you just get the portal vein. Okay, so down inferior to this is posterior to it, you can see the inferior vena cava, whereas you can also have the aorta in the same plane. You can see it. Okay, so normally that's what we can see on the organs, the liver and the gallbladder. But as we continue with the abdominal protocol, We shall see also other organs. So in the preceding part, which is part 2, we shall be looking at the great abdominal blood vessels. That is trying to see the inferior vena cava, the aorta, the branches, SMA, SMV, renal arteries, renal veins, then seeing the celiac trunk. So please don't miss just what you do. What I would request you to do, like my presentations and subscribe. Otherwise, thank you all. This is just good for students, and just be following my channels. They will help you if you have really issues with the ultrasound and sonography. Other videos are going to be coming up. Thank you. Just watch part 2. All right.